Hey everyone, today we're going to talk about concussions. You ever wondered exactly what a concussion is or how you should manage it if you're unfortunate enough to get one? Well, stick around because in this video I'm going to go give you a brief overview of what a concussion actually is, ways you can recognize it, and different tips to help you along your road to recovery and how you can help manage it. Hi, I'm Dr. Scott McCrimmon, a chiropractor here at Caledon East Family Chiropractic. Hope you enjoy our YouTube channel and all the videos put out by our healthcare practitioners to help keep you healthy, keep your family active, and keep your body in the best shape it can be. Okay, so for concussions, before we get going to talk about concussions and what they are and what you can do about them, very important to understand that this video is a general overview to give you some information to help you. It is not a substitute for medical advice. If you think you have a potential concussion, you need to have it assessed by a trained medical healthcare provider who has experience with concussions. A concussion itself is considered a mild traumatic brain injury, but anytime you have a brain injury, it's always important to get it checked out and make sure there's nothing more serious going on because we don't want anything bad that way to be missed. So again, if you think you have a concussion, make sure you get it assessed properly first, and this is just some information to help you along the way, and hopefully it'll help you understand what's going on. Okay, so let's start with what exactly is a concussion or how do they happen? So a concussion is a traumatic brain injury. We call it a mild traumatic brain injury, and it's generally caused by an acceleration or deceleration force applied to the brain and or spinal cord that causes a stretching or rotational force. So you can think of it here, if we take our skull here, it's anything that rapidly accelerates or decelerates the brain and causes it to kind of stretch out and elongate, and that does damage to the nerve cells, which are called neurons, in your brain, which causes a host of problems that we'll talk about in a second. So a misconception with concussions is that you need to be hit in the head. You definitely do not need to be hit in the head to get a concussion, although that's a very common way to get a concussion. But if you think of a really hard body check right to the chest that causes the head to snap forward and back, or to the shoulder that causes their head to spin rapidly, or you think of a car accident, you're driving down the highway, it's icy, you rear end somebody at a high speed, your head's going to snap forward and backwards. Your head may not hit the steering wheel or the window or the windshield, but you can still stretch and cause damage to those nerve cells, which can lead to our cascade of issues that lead to concussion. Another way we kind of think of it is if you think of, we've got your skull, your brain sits inside your skull. So sometimes I'll explain it to patients as think of a big ball of jello almost sitting inside a fishbowl, and then you rapidly shake that fishbowl around. Well, a couple things are going to happen. The jello is going to kind of bounce around off the sides of the fishbowl. But if you think of jello, when you move it rapidly, it kind of stretches and snaps back and stretches and snaps back. It's a rough example, but it's an idea of the stretching and pulling that happens within our brain when we have that acceleration or deceleration force applied to it. So when that stretching of the neurons happens and that twisting and elongating, it does damage to our neurons, which sets off a sort of cascade of reactions and things that happen in our brain, which I'm not going to go into detail in that, it's beyond the scope of this video, but it basically causes our brain to start to use up all its energy. And what happens to you, just think of your body in general, if you use all your body energy, what happens? How do you feel? Well, you're going to feel tired and exhausted, sleepy. And that's exactly how people feel when they get a concussion. For the first few days, they're often very, very tired because there's just not a lot of energy left in our brain for it to do what it's supposed to do every day. Now, being tired is one symptom of concussion, and depending on where the injury takes place in your brain or what neurons are damaged, there's a whole host of symptoms that can show up. So I have this sheet here. You can see all these symptoms here. There's a symptom checklist that we use in our office, and there's 22 accepted symptoms of concussion. So it's a lot of different symptoms that can show up. The most common ones are headache, dizziness, fogginess, nausea, maybe some balance issues, a lot of trouble with focus and concentration, lights and noises might bother you, but definitely fatigue, low energy, but with that fatigue, sometimes trouble sleeping. So there's a lot of different symptoms, but there's 22 accepted symptoms related to concussion. So again, depending on how your brain is affected, those symptoms might show up a little bit differently. But your headache, dizzy, nausea, those are sort of like, and as well as neck pain, those are the most common ones that jump out, as well as potentially all the other ones that are on that sheet and some that I mentioned there. So how does that look in your brain as far as how does that energy being used up in your brain start to show up as symptoms? Well, you'll have to bear with my drawing here, but I'll bring it so you can see it. So this is sort of a graph that we'll use briefly with patients. This is our energy line and our timeline. So if this is our normal brain energy up here, and then we have our traumatic brain injury, whatever accident or injury that happens, for the next period of time, often 4 or 5 days, our brain energy will drop, right? As your brain energy goes down, we're tired, a lot of those symptoms will show up. Usually at different times with people, but eventually it'll start to level out and it will start to work its way back up to normal brain energy. As your brain heals, most concussions will heal and get back to normal if we take the right steps and precautions to get it better. Now, the reason this graph is important, what I explain to patients about, is this is a roughly normal pattern of healing for concussion, and the time frames on there can vary from patient to patient. But what's really important to recognize is right around here, a lot of patients will go, yeah, I'm starting to feel better. But it's important to know when you're actually properly healed, as opposed to just starting to feel better, which is why it's really important to be under the guidance of a proper, a trained healthcare practitioner with concussions. Because what we'll often see, right, we'll get in our office after the fact, is patients can't starting to feel better, so they go back to their activity, their sport, whatever it may be. If we take another hit here, another injury to our brain where we're not healed, there's some really bad things that can happen. So on the worst end, it can be life-threatening, but even not to that degree is we can take a hit, now our brain energy is going to drop further, and the healing is going to take much, much longer to get better, or potentially, okay? So important to be followed along and take appropriate steps on your return to whatever your sport or activity or job, whatever it is, because if you go back too soon, take another hit, bad things can happen. So you want to make sure that you're doing all the right things. So when we talk about the energy, we'll call it an energy crisis in our brain, a way that I explain to patients to help them understand how this is affecting their brain and why they're getting the symptoms they're getting, is I use the example of a cell phone and a cell phone battery. So I'll tell patients often, okay, so you think of your brain, your body is a cell phone, your brain is the battery for your cell phone. So if you have your phone open, because most, especially our younger patients, they all understand phones better than I do, and you have 3% battery left on your phone, but you open 15, 20 apps on your phone, what's going to happen to the phone? The obvious answer is it's going to shut down, okay? So when we think of our brain after concussion, if it's our cell phone battery, the charge is very low afterwards. It's used up a lot of energy, the charge goes down in that battery, and it doesn't recharge, right? It doesn't hold a charge very well. So if you think of your phone, if the battery's low, what do? Well, you plug it in the wall, it recharges, battery's up, now I can open all my apps and do everything again. Same with concussion. With most concussions, when we rest, a little bit of energy is going to build up, and we'll go, okay, I feel better. Often symptoms are better when we first wake up in the morning, and then as we start doing things, which is like opening apps on our phone, then that energy drains and we start to feel symptoms come on. So patients tend to understand that with a cell phone, if the battery drops, the phone's going to shut down. Well, as the brain battery gets low, that is when your symptoms are going to start to show up. So the more apps you open in your brain, or the more things you do that take brain power, brain energy, the more those symptoms are going to be present and potentially increase in the severity or how you perceive them. So we talk to patients about learning to manage that energy. So first couple of days when the energy is low, there's lots of resting. Again, we'll often feel better when we wake up, we get out of bed, we go, okay, I feel a little bit better. And then we start doing things and the energy starts to drop, those symptoms start to become more evident. As your brain is recovering and feeling better, that brain battery is going to start to hold a better charge. You'll be able to do more before the battery drains. And so what you're looking at is getting that brain back to your 100% charge and back to its normal function. Now, it's important to understand when we use that analogy, the system in your body that uses up the most brain energy, that's going to drain the battery the fastest, is your visual system, which is why after concussion, people often hear, stay off screens, stay off phones, TVs, computer, why people have trouble reading or trouble focusing, because it tends to drain that battery the quickest and bring on symptoms. Same with loud noises. Again, your brain's got to process that loud noise. So that's stuff that will drain the battery the fastest. So it is good advice, initially when you have a concussion, to limit, our electronics. It's 2025. odds on people staying completely off cell phones and stuff, especially kids, is going to be a hard one. But we try and limit, we try and manage it. And when you feel that battery starting to drain in your head, we definitely need to put it down and move forward. Another thing that I always like to explain to patients as it relates to your energy is we need to get up and moving with concussion. We used to always hear, you have a concussion, go lay in a dark room. Does it feel better? Yeah, because there's no stimulation. There's not a lot of, your brain doesn't have to do as much as it would, so we tend to feel better. But the research shows that spending too much time laying in the dark room and not doing anything can actually prolong your recovery. So for the first day or two when you're feeling the crummiest, a lot of people, for sure, there's going to be a lot of resting. But as your brain is starting to hold energy better and you're able to get up and function better, the research shows getting your body moving is very helpful. So we have our patients usually walk a couple times a day, and that might be different for each patient depending on their capability and what they can handle. It might be a few laps around their living room. It might be to the end of the driveway and back. It might be around the block. Again, that's something that needs to be guided by a qualified healthcare practitioner so you understand what your body and your brain is capable of handling. But the point I want to get across is if you just lay in bed all day and expect to get better, it's not necessarily the best advice for each concussion. Okay, so another really important thing that we see with concussions that I find often gets overlooked is the involvement of the neck or the cervical spine. So when you think of, if you look at your skull, your brain sits inside, your spinal cord comes out the base of the skull, runs through our neck and all the way down our spine. And those who've been to a chiropractor before understand the importance of your brain and your spinal cord or your nervous system and how it affects the function of your entire body. And when you think of our concussion injury, this rapid acceleration, deceleration, or rotational force, it's pretty much impossible to do that without injuring the neck or the cervical spine with that injury. And we know that injuries to the spine, whether it's the ligaments, the muscles, the joints, or the nerves, spinal cord in there, can give you almost all, if not all of the same symptoms that a concussion can give you. And really, I think a neck injury is part of the whole concussion process. I personally think it's very rare that you actually get a concussion without some sort of involvement from the neck or the cervical spine. And since those symptoms can very much overlap, sometimes it can be very difficult to say, okay, is this because of directly from the brain, directly from the neck, or a combination of both? So very important to have the neck assessed and have it treated. We've had lots of patients where, we've seen good recovery and because we've done more work on the neck, or patients who've come in, they've had treatment other places, they've got to a certain point, but they've kind of hit a stumbling block, or those patients who the symptoms are just lasting a little bit longer than we think they should, and often the neck is part of the issue. So resolving that will help the healing process. So make sure wherever you're getting your concussion checked out, that you have a look at the neck. Even if it's not directly painful, it still could be involved in your concussion process and can influence your healing. So if you've been diagnosed with a concussion and you're on your road to recovery, you're going through your plan of management, you've had it properly assessed and had all the red flags and bad stuff ruled out, there are a few tips that we like to give patients to help them along the way. A lot of it is nutritional, so we start with making sure you drink lots of water. Your brain up here is mostly made of water. If you're dehydrated, it tends to make symptoms worse. It's also a good time to eat as healthy as you can. Things that bring inflammation up in your body will tend to aggravate things. So we look at limiting our sugar, definitely no alcohol. For some people, coffee is something, can make it better or worse depending on the person. If there's a withdrawal factor, it could aggravate the headaches. And gluten can be inflammatory for a lot of people. And you want to get high antioxidant foods in. So that's a lot of your dark berries, your pumpkin seeds, flax seeds, anything with lots of omega-3 in it. So a lot of times we'll recommend patients take omega-3 supplements, sometimes magnesium supplements. So all that stuff is really important. Putting yourself on a good nutritional regimen while you're healing will only help the healing process. We always say, if we think of our body and our brain like an F1 race car that's a multi-million-dollar car, you're not going to sit there and put regular unleaded gas in it. You're going to put the best fuel you can to make it operate at its best. And while your body's healing, especially, it's a really good time to put that proper fuel in it. Other things, as we mentioned, getting your body moving. Okay, within reason, what's appropriate for you, but getting your body moving is often very helpful. Incorporating sometimes some stretching and yoga, especially for the neck, again, if it's appropriate for you, can be very, very, very helpful as well. And then another thing that's been shown, especially I find our patients who are struggling a little more long-term, there's some good research on meditation and concussion. And I have patients that will roll their eyes when I say, have you ever tried meditating? But we get them to do it. It's a skill, especially if you haven't done it. It takes a little bit of learning, but it can actually be really helpful at calming symptoms down when they're aggravated. But again, a lot of it is managing your energy. So again, your brain's maybe not holding a charge, right? So you can just do little bits at a time before that battery drains. As you're healing, you'll be able to do a little more and a little more and a little more. But if you have to rest, then meditation can be helpful. One other thing that's important that we recommend to our patients is we try and limit the napping during the day. It's very common. First couple of days, as I said, you're going to be tired. There's going to be a little more sleeping. But especially if we take our high school kids, which is a common population that we see, they're bored. They're at home. They're trying to stay off electronics. They're bored out of their mind. They just end up sleeping half the day away. And then what happens is now they're staying up a little bit later at night. They have more trouble falling asleep. Now they're sleeping in until 10, 11 o'clock. And that whole sleep-wake cycle can get a little bit messed up. So we try as best as we can to keep our sleeping routine fairly similar to normal as we're healing. And yes, you're going to rest during the day, but maybe it's a little meditation or just relaxing on the couch as opposed to a full-on 2-3 hour nap in the middle of the day. Again, everybody's different, but those are some things that we find helpful. Most important thing with a concussion, in my mind, is recognizing that it's there. A lot of sports like hockey and football, they're high collision sports. Things happen. People, they get shook up a little bit. And that athlete mentality wants to keep going. We have a lot of patients from soccer and basketball because, we get hit in the head surprisingly or run into bodies where our head snaps back and forth surprisingly often. So we always tell people, if you think you potentially have, something doesn't feel right, you got your bell rung, you see stars, you got a little bit of headache, a little bit dizzy. Most important thing is stop, get checked out. The only real mistake you make is going back too soon, getting hit again, and then bringing on all the potential bad stuff or prolonged symptoms that can go along with that. So you're always safer. Get it checked out. Make sure everything is good, and you'll get back in the game soon enough. So recognition is a key. Never play through symptoms. If you got hit and you got a headache, you're dizzy, something doesn't feel right, just take a break. They say when in doubt, sit out, and there's a reason for that because you want to avoid the potentially bad things. Well, I certainly hope you found that informative and helpful. It's a brief overview, but hopefully it gives you some insight into what's going on with concussion in your brain, why you maybe feel the way you do, and things you can do to help yourself along the way. As always, most important, recognize it, get it checked out, get it managed properly so you can get back to your sport, your school, your job, whatever the case may be, safely and back to full function. And as always, check our YouTube channel. Our practitioners are putting out videos pretty much weekly on various different healthcare topics to help keep you and your family healthy. If you like this video, give us a thumbs up. Subscribe to our channel so you can get get notifications whenever the next video comes out. And so hopefully the ones that are right for you will help you keep you and your family healthy. Until next time, take care.